Hi, everyone, and welcome to episode 40 of Holistic Movement with me. Today, my name is Inspector Lacroix, and I invite you to come lie down on your backs. And if you can, separate your knees and place your left hand on your left inner thigh or on the inside of your knee, and your right hand on the right inner thigh. We're going to start with this position, but today we're going to do this position. And then we're going to help release reasons behind the wrist. If you have any wrist pain, that's for former student client of mine, Jessica. Hi there, Jessica. And then we're going to do some knee stability and hip stability, foot stability exercise, balancing exercise, a continuation of what we did last week. And then we'll do some elastic recoil, connective tissue strengthening, and then if we have time, maybe we'll do an extension, but if not, that's it, just 4 positions. So I'm going to relax my shoulders, and the thought of today's episode is, and I'm opening up with a question, are you curious about your body? Do you have a desire to learn more about your body? I hope you do. Maybe that's why you tuned in. I am very curious about my own body and how it works. And if that answer is yes, then I'm asking you now with no purpose or reason for solving anything. I just want you to watch your body and how it reacts when moving and how you react, maybe emotionally, physically. Do you tense up? Do you relax? So that's why we're opening up with this really slow movement. So I'm going to exert pressure with my left hand into my left inner thigh, and I'm going to just rock my pelvis to my left, and then I pull with my right hand. So I'm not tensing my thighs at all, or my butt, or my spine, or my abdominal region. I'm just using my shoulders and arms to rock myself to the left and right. That's all we're doing. And are your shoulders tensing too much to pull you to the left and right? If they are, can you lessen that tension a little bit? Indubitably, there will be tension in your shoulders to help you rock to the left and right. Okay, and now on the next pull of your right hand, I want you to see if you can pull the outside of your right thigh down to the floor and let the left knee just fall to the right, and you come and just lie on your right side in the fetal position. Yep. Then you're going to pull your left knee to the left using the power of your shoulder, and I just tense my left shoulder too much, so I'm going to relax a little bit. And I'm just going to keep pulling it to the left, place my right hand back on that right inner thigh. Keep pulling until it pulls my right thigh to my left. Yep, fetal position on the left. And now we're just alternating back and forth. So the only thing that is fairly tense, because remember, tension is the precursor to movement, are my shoulders and my hands and my arms. And I'm just letting my whole spine and pelvis go along for the ride. And what do you notice? What's your reaction when you do this? Do you want to tense up your pelvis and shoulders? Sorry, your pelvis and your spine? And if you do, maybe ask yourself why. Why do you need to tense them? They're already pretty tense, I'm sure. So can you let that go and just use the muscles in your hands and arms and shoulders to pull you? And then what do you notice about your breath? Are you watching it? Are you inhaling when you're pulling up with that one hand? Or are you exhaling? Let's do one more. Okay. Let's lie whichever side you're on. Maybe you're on your right side. Just roll a little bit. Let's lie on our backs. Let's drop our arms. And then feel how your pelvis is touching the floor. And let your body fall. And when you let it fall, how are you reacting to that? Okay, let's bring our left arm next to our left ear and our right. We're going to bend our right knees, roll on over to our left-hand side. We're going to come on up, and we're going to do some wrist releasing techniques. But get this, you get the trifecta, because not only are we helping release wrists, but we're also releasing the back of the neck and the rib cage. Yes. Now, we're doing this position mainly because of one of my former students, as I mentioned earlier. She moved back to America and she messaged in comments saying, "My wrist, can you help me with my wrist?" And luckily, I'm making a video right now to address one of the reasons behind wrist problems. And I go into intricate detail about that, but we're going to try to keep this simple, and we're just going to affect the pec minor. Meaning we're going to release the compression, which most of us have because we're in a state of flexion like this. And there's compression in the pec minor. The pec minor is attached to the coracoid process. The coracoid process is the beak, literally crow's beak, that attaches to the shoulder blade. Hopefully you can see this right there, that little beak. My model's missing an arm there. And when there are four muscles connected to that, and when those four muscles, one of them is the pec minor, the coracobrachialis, the short head of the biceps, and the omohyoid there connecting up to the jaw, when they become short and compressed, they'll pull this coracoid process down and the shoulder blade gets hiked up. So why does this affect the wrist? Because of two connective tissue lines, actually four of them, which I go into more in depth in that other video, plug. Check out the link there. The superficial front arm line and the deep front arm line. Your hand, myofascially, is connected to your sternum. And so if there's a restriction up above, it's going to pull on the wrist. Let's get to it. We're going to come into, I'll show you from a few viewpoints here. I'm going to tuck my toes under, or you can flatten the feet. It's up to you. If you're having problems coming down because of maybe hip mobility or knee problems, then place some pillows or a roller underneath. I'm going to bring my hands wider than my shoulders. I'm going to concentrate on my sternum. I'm going to try to bring my sternum down as far as possible. Now, I'm able to get my chin down, but I don't want to do that now because I've got my mic right here and it'll mess it up. So I'm going to concentrate on my sternum, trying to push that down. And I'm going to observe and watch which side of my pecs is more compressed. And I feel more restrictions. For me, it's the left. So I'm going to lean a little bit to the left. If it's your right, you lean to the right. I'm going to lean into my left here. I can turn my head a little bit slightly to the right, just to floss my neck a little bit. And now I'm going to push my palms down, separating my fingertips as much as I can. And I'm going to exert pressure with my palms down into and connect that to my pecs, especially my left pecs and my pec minor and my pec major and my lats. Yeah, and I can feel that tissue open up. Now, if I want a longer lever and create more mechanical force, I can try to straighten these arms. I don't want to bring them into internal rotation, though. I want to keep them in external rotation. And then can you, when you inhale, chest comes up, and then exhale, push that sternum down. So let's get into that rhythm. Inhale, let the chest come up. Exhale, push that chest down. If you can picture and imagine the back of your rib cage pushing down into the floor and going into your sternum and then the sternum coming down, that will help even more. If you want to add a little bit of rotation here, you can rotate your ribcage to your right as you're pushing the left armpit down. And then let's switch. Now rotate your ribcage to the left and push your right armpit down. And then push your left armpit down. Rotate your ribcage a little bit to the right. So it's a slight rotation. So if you're pushing that right shoulder down, and not shoulder, sorry, sternum and chest down, then you're rotating your ribcage to the left. If you're pushing your left sternum down, your left pecs down, you're rotating your ribcage a little bit to the right. Let's do one more. And of course, feel free to pause the video and concentrate on which side. Stay a little bit longer. We're just staying a little bit longer on that left because it's all about me. Not you. That's why I'm doing this, folks. Yep. Let's come on back up slowly. We're going to lie on our backs. Rest here. Take a few breaths here. Let your body just kind of sink into the floor. And do you notice any difference between your left arm and how it's touching the floor and your right arm? Can you watch and not do anything about it? And watch your reaction to it, your breath, and the rest of your body? Again, we're not trying to solve anything. We're just trying to observe and watch. Okay, let's bend our right knees. Bring your left arm next to your left ear. Use your right foot to roll yourself over to your left-hand side. We're going to come stand up, and I'm going to give you the classic maybe look, looking sideways at you. That's what models do. Maybe I'll pay attention to you. The next movement is a variation of what we did last week when I talked about Coach Green on Instagram and his mobility exercises for the knee, and I really like that. Instead of using the resistance band, though, we're going to add movement from the spine to teach the pelvis, the knees, and the feet to absorb different directions. So then these muscles can eccentrically load, lengthen, and strengthen at the same time. So we're going to stand on our right foot, and I'm going to bring my left foot in front and just draw a half circle. So my right foot is stable. I'm keeping my right leg straight, tightening my right butt cheek and my quads and my inner thighs. And I'm just drawing this half circle like this. Now when I draw the half circle again, when I bring it from the front to the back, I'm I'm coming into flexion. I got confused there. Okay, and I'm bringing my upper body forward as I bring my left foot back. Then when I bring the left foot forward, I bring my upper body back into extension. And if you want to widen the arms a little bit, maybe you feel the balance is a little bit tricky. And anytime you feel like you're going to fall, you can bend that knee and just put more weight on the left foot. Now, just to be clear, the left foot, there's no weight on it at all. You're just sweeping the leg. So the leg goes back, upper body goes forward. I'm trying to relax the shoulders, and then left leg goes forward, come into full extension. I'm really using the abdominal region. If you feel this is too difficult for you, bring the arms out to the side like this, okay? But I really like the arms up above because I can add more force to my lower back and strengthen it. Yes. Okay, now coronal movement. I'm going to turn here. You don't have to turn. I'm going to bring my upper body to my left, and my arms may go out of frame like they have before. And my left leg goes to my right. It goes past laterally to the right of my right foot. Then I bring my left foot to my left and draw that half circle, and I bring my upper body to the right. Let me show you from your angle so you can kind of see that there. And then the foot comes forward. I bring my upper body to my left. And remember, it's not so much the arms as it is the rib cage. And I'm really lengthening my rib cage to my right here, the right side, lengthening there. And then when I go to, my upper body goes to the right, I'm lengthening my left leg. And if you want to hang out there and just breathe into it and really bring that left leg behind and lengthen the whole left leg. And I'm using my right big toe to balance there. Let's do a couple more. Yeah, and I'm breathing into the sides of my rib cage to expand that rib cage. And I can really feel it on those right glutes there. Now, rotation. So now I'm bringing my upper body to rotating it to the left as my left leg goes over. Same position of the foot as we just did in that coronal plane movement, but now we're just doing it transverse plane. Let me show you from your angle. Felt like a Las Vegas showgirl there. Yeah. And I'm really pulling on those glutes, those right glutes. Trying to relax my mouth. Be aware of any other parts of your body that you're tensing. See if you can watch them. And then see how you react, of course. And then relax them. Yeah. Let's lie on our backs. Let's take a break here and feel the right leg and how it feels falling now, and feel the sensations. Watch it internally and observe what it's doing. I feel a lot of activation in my right SI joints. So I forgot to include that. There's some added benefits. So we got the trifecta. We got the foot, we got the knee, we got the hip. Sorry, we got the, what would that be called? Quadrectra? Okay, let's bend our right knees again. Let's roll over to our left-hand side. Let's come up to the other side. So we're going to balance on our left foot. And we're going to bring those arms up. I'm going to come back into extension, my upper body. As I bring my right leg forward, I'm engaging my left quads and my butt. And then I come into flexion. My left foot comes back. Now, I forgot to draw that half circle. I just brought the foot forward and back. Now I'm drawing that half circle. So, yeah, and if you want to get fancy, you can bring that right foot behind you, cross it over the left. Did you see that? Yeah, so you not only got extension, but you also have that rotationary movement in that pelvis too. Get inventive. These are not the only movements that you can do. Can you hear that sliding of the foot? The electric slide there. I'm really engaging those left glutes. Teaching my vestibular system, that's the fancy word for the balance in your ear. It comes from your ears, folks. If you tuned in a few weeks ago, we did the 5 Tibetans, and one of the first movements was the swirling dervishes. Yeah, okay, now let's do coronal. So now my upper body goes to my left, and my upper body goes to the right. Find that foot position. Really lengthen that right leg to get that pull on the obliques and the lats. So when I bring that leg behind, that right leg behind, I can bring my right arm to the left as well, and I can get that pull right into my rib cage and the pelvis. I'm trying to relax my shoulders, and I'm thinking, how can I move my rib cage to get my rib cage to pull on my lower body? And how can I get my lower body to pull on my upper body? So we got all these different eccentric pulls. Okay, now rotation. With unfortunately no inebriation. But maybe later after the class you can add some inebriation with some carbonation. Anyway, that was Cajun Man, Adam Sandler's amazing character on Saturday Night Live. Maybe I'll put a clip down below. Silliness. Let's do one more. Yeah, let's lie on our backs. Let's rest here. Oh, and I feel that left leg. Yeah. And I'm watching and feeling my whole left leg and how it just supported me, and what musculature is turning on now, being activated. Keep falling here. Keep watching. keep reacting, but don't need to do anything about it. It's like you're watching yourself with no purpose, being open to whatever happens, embracing the chaos that is. Okay, let's bend our right knees. Bring your left arm next to your left ear. Push yourself over to your left-hand side. And it's time to become kangaroos and create more elastic recoil. Last week, we did a jumping lunge in all 3 different planes of motion. And I explained and talked about elastic recoil and creating resilience within the myofascial web. We're not going to lunge forward, we're going to jump to the side this time, and we're only going to come into extension because this is a very challenging movement. I'm going to show you from your perspective. We're going to have our feet together, starting out in the center. I'm going to push off with my right foot, and I'm going to jump. Now watch my arms. I'm going to bring my arms out to the right, and I'm going to push off with my right big toe, jump to my left foot, and let my right leg swing behind me, okay, and then push off with my left and do the same. And we're just jumping and jumping and letting the legs, the back leg swing behind and the arms swing behind. So if I jump to the left, my arms swing to the left. If I jump to the right, my arms swing to the right. And so this whole right, the lateral side of your leg has to stabilize to maintain balance. But not only the outside of the leg, the inside of the leg too. And guess what? The connective tissue lengthens, but the muscle does not. It's kind of like an isometric strengthening exercise for the muscles, but for the connective tissue, it lengthens and strengthens. And you're creating that strength within the myofascial web. So here's the elastic recoil. Here I'm pulling back the bow, I'm squatting down, I'm bending that right knee, and then boom, pushing up and jumping, landing, and then the connective tissue resists me from falling over, although I almost just busted it. Let's do one more. Now we're going to come into extension. So this right knee, I'm going to bend this right knee. I'm going to come up into extension. I'm going to lower the arms, kind of like a cat springing into action, and then jump onto that left leg and come up into extension here. And you might fall. And then again, lower the arms, come up into extension, land on the right foot. Come down, bend the right knee, spring up, extension. Let that right leg fall to the left. Spring upward. You're a leopard pouncing on its prey. Be that leopard or be that kangaroo. Getting away from... Are there leopards in Australia? I don't think so. Ooh. And you notice that a couple times I'm having problems balancing. So that back foot is kind of my rudder there, helping with the current. Let's do one more on each side. Yeah. Let's lie down. We're all done. And we got that extension in too. But it was a dynamic extension. Wow, so much going on in that. I'm breathing through my nose to try to calm my breath down. Letting my body sink and fall. And again, remember the theme of the day is watching the body internally. Meaning observe it, and see how it reacts. And there's nothing to do about it at all. There's just feeling. See you next week.